beginning with Calgary Fish Creek, followed by Edmonton Southwest.
Thank you, Mr. Speaker. Over the last few months, this government and the Minister of Health have been desperately trying to convince Albertans that change and improvement is coming for our healthcare system. Yet, earlier this month, the official and administrator of AHS, Dr. John Cowell, quietly announced that the former chair of the Audit and Finance Committee was reinstated into that role, only 4 months after he was supposedly fired from the board for refusing to cut executive bonuses. That doesn't sound like change to me, Mr. Speaker. Can the Health Minister please explain why a fired board member has quietly been rehired to oversee the finances of AHS?
Mr. Speaker, there are a number of very important functions that the official administrator must provide for excuse me, with respect to Alberta Health Services. One of those is the appointment of a Audit and Finance Committee. Mr. Speaker, the committees in place at Alberta Health Services include people from many different walks of life and with many different areas of expertise. The chair of this particular committee is well known as a leader in the community of audit and finance, has considerable experience in the public sector and healthcare, and is very well qualified to take this role.
Honourable member.
Thank you. Given that the same individual chaired the Finance and Audit Committee this past spring when the Auditor General slammed AHS for $100 million in expense claims and a little to no reporting even up to the board, is the Minister of Health a little worried that putting the same guy back in charge of that committee could turn out to be a rather expensive move?
Mr. Speaker, given the way the honourable member asked the last question, my question to her, would she not agree that the most qualified individuals in a specific field should be appointed to serve in areas where the public interest is paramount? Mr. Speaker, Alberta Health Services is an organization that administers over $12 billion in taxpayer funds in this province. As I've said, this particular chair of the Audit Finance Committee, the other members of the committee are qualified in their own right to provide advice both to Alberta Health Services and to provide a scrutiny around the management of financial affairs in the organization. We will continue to appoint the most qualified individuals to serve in these functions.
Honourable member.
Thank you, Mr. Speaker. Oh, he's qualified, all right. Doesn't listen to the minister, is slammed by the Auditor General. Given that during his time at Capital Health, Aladdin Morale was allowed to bill taxpayers for repairs to his Mercedes, fine dining, and butlers, and given that the chair of the Capital Health Audit and Finance Committee was, guess who? Can the minister see there might just be a little problem?
Mr. Speaker, what is appalling is the fact that this honourable member would, I can interpret in no other way, would attempt to taint the reputation of an individual that is serving Alberta in a position in which he is eminently qualified to serve. So, Mr. Speaker, as I've said before, the Audit and Finance Committee is a very important part of the operation of Alberta Health Services. I think taxpayers expect and deserve that kind of scrutiny over the financial affairs, and I congratulate all the members of the committee on the excellent work that they're doing with AHS and with the Auditor General of this province.